Good day, everybody. I wish to share my update on the local situation of COVID-19 in Hong Kong. Remember, 4 months ago, Asia was heavily hit by the COVID-19, particularly South Korea, China, Singapore, and Hong Kong as well. And in Europe, Italy was very in a very urgent situation. Now, as a few days ago, there were over 10 million cases in the world, with 500,000 people died, and the death rate is around 6%. And USA topped the list with over 2 million cases and 128,000 deaths. And this is how it looks like in the world chart. And as I mentioned earlier on, America is top the list, followed by Europe and the Eastern Mediterranean countries. And Southeast Asia has been easy off. Now, China has been doing very well in the last few months, with figures not rising too much in the last 4 months. So there were 85,000 cases in mainland China with 4,600 deaths. In Taiwan, there were fewer than 1,000 cases at 447 and only 7 deaths. In Macau has only 46 cases, no deaths. Back in Hong Kong, up to this moment, we have 1,269 confirmed cases, and mostly are imported cases and close contacts. And there have been 7 deaths, and this is a very low fatality rate at only 0.4%. And of course, our multi-pronged strategy has been contributing to the successful prevention of the outbreak and contain the COVID-19 in Hong Kong. Recently, doctors from the Center for Health Protection of the Department of Health has published a paper on the epidemiology of COVID-19 in Hong Kong up to the end of May. Now, all these cases were actively notified by doctors, particularly in the private sector, up to 31% of the cases, and surveillance of the returning travelers consisted of about a quarter of the cases, and contact tracing has found about 20% of the cases, and the rest are those who attended clinics, hospital, A&D department, general outpatient clinic, for the remaining 20%. So overall, doctors in the community are referring almost a third of the cases. There's a slightly male predominance in the amount of cases, and the age group mainly at around 37 years old. Of course, it range from a baby of 40 days to the very old of 96 years. And only 79.2% of the patients had symptoms, mainly cough, fever, sore throat, headache, and running nose, which are very non-specific. And they are commonly seen in flu and common colds. And Please take note that 20.8% were asymptomatic, which means that they do not feel anything at all. And the paper also has described the period into 4 phases. As we know, initially we had quite a number of cases from the mainland, and that was the time when the government started to get prepared. And in the month from February to early March, we had quite a few local cases in clusters, including the temple in North Point, bars in Lang Kwai Fong, and so on. And then it's followed by phase 3 when we have an influx of returnees, mainly students from overseas, and that's the phase 3. And then at the end of April to end of May, it is called the phase 4, when we have more control of infected cases imported, and some limited local cases. So as a comparison, in March, there were 113 cases and 3 deaths in Hong Kong, whereas now we have 1,269 cases and 7 deaths. It's still very low in world standard. And the onset to admission range from 0 to 43 days, and the mean is 3.2 days, which means that the majority were admitted. And the average length of stay in the hospital is about 3 weeks. The maximum is almost 3 months. And as I said, many cases were imported, and that there were 60% of them, mainly from 5 common countries. They have visited United Kingdom, United States, France, Pakistan, and Switzerland. And last month in June, we had cases mainly from India and the Philippines. And the majority of these cases were among the young age group. 40% were below 24. So they are mainly students. And luckily, we do not have any apparent or significant outbreaks in our community. And about half of the cases were linked in their clusters, ranging from 2 to 105 cases. They are mainly household members or people who travel together. And of course, there are big clusters occurring in some social gatherings or venues like the bars, where they share the drinks and food happily together. So, contributing to our achievement in combating and containing COVID-19 is the effectiveness of our public health measures. We have a very robust public healthcare system with preparatory works in place, and that involves some legal framework and logistical groundwork by the government, supported by the community and the professionals. And of course, social distancing is working, like suspension of schools, work from home, canceling of large-scale social events, and closure of some community venues, and so on. And we also have good surveillance practice in place, like testing the returning residents, temperature screening in public venues, including the library, post office, and some supermarkets and the restaurants. And of course, lockdown, although we did not have a total lockdown, but still, together with border control measures, including entry restriction, mandatory quarantine, and compulsory home quarantine, all these are working very effectively. And of course, we have to give credit and we have to congratulate our own community, the Hong Kong residents who are actively participating and are very cooperative. And as such, is playing a very important role in our success in containing the epidemic in Hong Kong. There's a very high level of awareness and vigilance among our people who wear facial masks. At the moment, it's almost close to 100% of people in the streets and public places wearing the masks. And of course, we attend to hand hygiene and environmental hygiene together with work and study from home. And it's a very, very significant public-private partnership in terms of working together, and everybody is contributing to all the necessary measures in combating and containing COVID-19. There's some bad news. A recent published paper from the University of Hong Kong has shown that in the community, there were 19% of people who have shown some signs of depression, and 14% had anxiety. Now, quarter of the respondents had reported that their mental health had deteriorated since the pandemic because they worry about being infected. As I mentioned earlier on, 20% of the cases were asymptomatic. We don't know who are suffering or carrying the bug or the virus, and they are bothered by not having enough surgical masks, although this is not the case at the moment, and they are bothered by not being able to work from home because the home situation might not be ideal to work from. And we also have a study in May and showing an even worse percentage, where 30% of mainly the young people who had depressive symptoms. So just a recap on the preventive measures, what we should do, social and physical distancing, by avoiding going to crowded places and venues which are at high risk, like hospitals and clinics. Wear a facial mask when you go out, and cover our mouth and nose with tissue paper and when sneezing or coughing, and attend to hand hygiene and environmental hygiene. Now, this is available from the government's specific website on COVID-19, on what we should do to avoid causing any mental problems and so on. And we also advocate that psychological support, such as brief home-based psychological interventions, should be provided to the citizens during the pandemic. So I leave it to you to read. You can scan the QR code or search your website to read about what you should do or what you can do to avoid causing any problem to your mental status. And this is the infection triangle. Now, to start off with, there must be a bug or the microbe or the virus and so on. And the measures is by sterilization and through antiseptic measures to get rid of the virus. And of course, to make it a case or infected case, there must be a host or a human being who are being infected. So in order to avoid it, we should keep our health status in good condition. And of course, for the COVID-19, there's no vaccination yet. We are hoping that the vaccine will be available in due course. And of course, there must be the route of transmission or the spread. So attending to hygiene and or quarantine measures will help to stop the spread or the transmission. And of course, psychological support is equally important in the management of the epidemic. So we must remember the three major factors in any infection. All right. So either we get rid of the bug or we keep our immunity in good working condition or we stop the transmission. And of course, lastly, I'd like to share with you an article on the health and the community, which is very, very important in our daily life. And please read it at your leisure. And thank you for your attention.